just get people better. Like right? Like just get the result. Figure out how to get the results. FT is a great add FT to your practice, add other things to your practice. I also love that you said it's not a standalone thing. Like you're not saying it's the only way. You're saying this is an important piece of the puzzle.
Welcome to the Dr. J.J. Thomas Podcast.
Hey everybody, welcome to the Dr. J.J. Thomas Podcast. I'm J.J. Thomas. Very happy to have you here, and especially with our very special guest, Dr. Goodman. Hi, Dr. Goodman. Very lucky to have him. Dr. Goodman is the creator and founder of Foundations Training. If you're already familiar with Foundations Training, then you know that he is an authority on movement patterns and helping people restore healthy movement patterns. And if you don't already know that, then you need to listen to this episode because he's a true pioneer in terms of really just breaking open a huge thought content that will change your practice, both as a clinician and if you're just a patient listening, it would change your practice as well. So thank you, Dr. Goodman, for being here.
Thank you. That was a really nice introduction. Thank you for the kind words. I appreciate it.
Yeah, well, meant from my heart. I mean, there is a reason I wanted you on here, and you're one of my first guests on here. It's true. Everything. Your product is amazing. Your work is amazing, and I'm really looking forward to hearing all different avenues of FT, and
Sure.
Both from a clinical side and from a business side. But if you wouldn't mind, I'd love for the listeners first to hear a little bit about your background and story, and kind of how FT came to be.
Sure. I'll give kind of the important parts and do my best not to bore. So I'll start here. I'm 43 now, and I've been practicing foundation training every single day since I was 27. And that's approximately a 16-year span. So from the 10,000 hour standpoint, I promise I've paid my dues.
Yeah.
But what it is it's what I have to do for my back. That's what foundation training is. When I was about 19, 20, 21, I was in college. I was weightlifting a lot, and I was playing water polo. Before that, I had played ice hockey, and I just had this kind of stemming back pain that was getting pretty unmanageable. By the time I was 20, 21, it was painful. I would really get nervous of my back going out, and it started to stop me from doing the physical stuff to a degree. So then fast forward a couple of years, I'm in chiropractic school. I'm a doctor of chiropractic now. But when I was in school, I was sitting a lot, getting adjusted. So you're getting adjusted by people that are learning how to adjust. And that's part of school.
Yeah.
So let's just say it wasn't always the best for my steadily increasing degenerative processes in my lower spine and hips. Although my hips, even to this date, my hip joints are strong and healthy with very mild, if any, degeneration. It's my spine that got me and continues to. So my back went out to the point 26, 27 years old that I was really strongly considering fusion surgery. That was recommended by the doctor and osteopath that I was going to in Orange County. I was in chiropractic school, like 80% of the way done with chiropractic school. And it got to the point where I'd kind of get into a position to adjust a patient and I'd hurt my back. And it didn't look like it from the outside looking in. I was very fit and strong and I was a big guy, but it was an increasingly problematic situation. And I was really not sure I was in the right profession. And that was its own kind of emotional process at
Sure.
cost and experience of getting through that to that point. Luckily, I don't know what your listeners are into or not, but I just tell my story as it happened. And
Okay.
I started smoking a little bit of pot, maybe a lot of pot, for pain relief. And it did something, interestingly, that enhanced what's called somatosensation in my body. It does it for everybody, mind you. I'm not special. That's one of the benefits of cannabis is at low dosages, a heightened awareness of somatic processes within.
Interesting.
I got the benefit of that very early on. And I would literally be laying in my room on the floor, just trying to get myself into comfortable positions.
Yeah.
And there was one very distinct experience that changed how I thought about my back forever. And that was being in a yoga class, which I did a lot of yoga to try to get out of pain. And usually, to be honest with you, it worked pretty good. A couple days of yoga, I'd be feeling a good bit better. I still practice some. I was in a yoga class and they were having us in a chair pose, and it hurt because I didn't quite know how to do it, and I was rounded, and I just extended my lower back really hard, but I didn't do it. This was the thing. I didn't do it by pulling up. I did it by trying to lengthen my hamstrings, taking my tailbone further behind me and up. That proximal hamstring yank and contraction that levers, as I've learned now, levers the torso up really nicely like a crane. And that lever turned my sensation off of pain immediately. I mean, boom, in it. What is happening? Okay.
So cool.
And I can experience it. I can still feel it. I still get really excited. And it's my favorite thing to show people that need it, which I have found out is not everybody, but it's a lot of people. But that's kind of my story. That starting point, that launch ramp of understanding that extending the lumbar spine in my personal experience was very, very important. Even though in all of my rehabilitative studies prior to that point, I was told to avoid that. I next started playing with internal rotation, not because I'm smart, I promise, but because when I would do it, it turned off the pain pathway. Of, in my experience, the sciatic nerve, the piriformis, the extensor, or the external rotators of the hips. I could turn my hips away from each other behind me, like I was trying to turn my back pockets out away from each other. And it would further eliminate the pain. This was not day 1, day 2. This was year 1 to maybe year 4, year 5. I'm already graduated chiropractic school. I'm starting to play a lot with proximal hamstring contractions. I've created some exercises like the founder and the woodpecker that were very deliberate proximal hamstring contractions turned into sort of more advanced exercises over the years. And my favorite exercise I ever created is not the founder. It's the anchored back extension, which was the first pose that I could do daily to repeat the pain benefits in my own body. And it squeezed my adductors together really hard to traction my pelvis toward my knees. And that would buy me just enough elimination of compression to be able to extend my back and strengthen the muscles of extension. That was my baby for years. It was it was literally, I would picture in my head an anchor line from my arches of my feet to my groin muscles, to my pelvic, to my pubic symphysis. And as I squeezed it, I would imagine that anchor line pulling away from my disc herniations and compressions to the point that I could really feel it.
That is so cool.
That system, that equation, I don't know how else to say it.
That chronology of events,
that
right?
process is the greatest thing that has ever happened to me, by far. And it hurt, but it not nearly as much as it helped. And that strengthening process gave me an understanding of what I call the anchoring line and decompression breathing. And again, it was a years-long, every single day study, getting myself out of pain. And then I had some really trusting friends and patients that just let me play a little bit with them. I got them good enough results that they let me keep going. And so anyways, that's why I said I was going to try to keep it short. That's my story up to now, is I just keep trying to make it better.
And you can't keep it short because it's not a short process. I think that's important. Like, I don't want to neglect that. I think one of the things you said from the very beginning just now that struck me as important for our listeners is how many patients have we had if we're clinicians, and how many people have felt this situation where they feel hopeless in terms of, like, they're given a diagnosis, they believe that diagnosis is dooming, and their back is never going to be better unless they have surgery. And you had the confidence, number one, confidence in your body and confidence in your own exploration to be able to say, no, you know what? I'm not going to accept that. Like, my back may not be the best, but I have all this entire system that I can work with to make it better. So that's really cool to hear that.
And to be clear, that confidence in my body wasn't random. When I was 18 years old, I became a personal trainer. I was with what's called the National Strength and Fitness Association, or the National Strength and Fitness, because the strength and conditioning is the bigger one, and it wasn't that one.
Okay.
It was pre-NSCA.
Got it.
This was 1998.
Okay.
And I became a personal trainer online because I was just interested in the body. I was training in the gym all the time. I was I was fascinated by both bodybuilding and strongman and just kind of the processes of the body.
Yeah.
And so I was kind of naturally leaning in the way of exercise, very, very much so. And by the time I was playing with my own spine, I really trusted my understanding of the body to that point.
Mm-hmm.
Would I understand, I wouldn't trust it now with what I know. I would want to have somebody much more advanced, but it was working.
Yeah, but you trusted the process too of like, okay, if I move this way, what happens? If I move this way, what happens? I think people aren't patient enough with that. Like,
And
I
it
feel like
took a
people
long
want
time.
that quick answer, right? They're like, oh, that didn't work. Oh, I'm doomed,
I honestly, and now this wasn't something like, I wasn't going into this as a very meticulous person saying I'm going to test this for 100
Yeah.
days and all.
Yeah.
But if I had to sort of average out, honestly, how long kind of an adaptation of a pose or a process or the correlation of what I'm feeling and what the movement is, and then okay, if we slip this way a little too far, those were half a year to a year each in the making.
Awesome.
Like you have to go through the sensation over and over and over until you're it's first nature. It's not second nature. It's first nature. It's 100% your prime language. And that's what somatosensation can become for anybody. Prime language.
Cool.
You can really understand.
So I would love to, I talk about FT quite a bit. One of our staff is trained through you guys and she's eating it up and our patients are eating it up. We love it. And we're using it more and more. Everyone else is like, watching and listening and trying to adapt it. So I think you and I were talking earlier about our entire staff being trained, but when I try to describe it, I feel like I probably don't do it enough justice. So I would love if you could give me, your elevator speech on what it is and how it's different from traditional training methods.
I'll try.
I know. I'm sorry.
I've been trying to describe this. I've been trying to describe foundation training for 15 years.
I know.
I still don't think I do a good. I'll try. Okay.
Okay.
So
Okay.
I have one base description that is
Yeah.
what I call like sort of the doctoral level. If you're a practitioner that pays attention to things going on and you're not just status quo, you're not just going through it, you'll understand exactly what I mean when I say this. And it's in my True to Form book. This is kind of my thesis. The body will get better in general at both holding itself, at feeling better and experiencing less pain if we focus very heavily on a re-education of the axial skeleton towards expansion. The result of that is an appendicular skeleton that tries to hang on a little harder against that expansion. And that intertwined tensegrity is what the fascia is kind of there for. Not just from a muscular standpoint, but with that expansion comes better tension of the interoperations of the viscera, of the blood vessels, of the lymph tissue, of Perry Nicholson's whole world. I love Perry. He's amazing. What a brilliant man. Like he's helped so many people because he correlates systems within an aquarium, not a system within itself. I love it. He deserves every accolade he gets. But that style of thinking, all of it improves with axial expansion. And that's kind of why I teach that. That's what decompression breathing is. The other thing is that if the hips and the pelvis are taught to lead the way accurately, meaning any movement that the body does is originated at the center of gravity, meaning if you rotate to the right, your hips just drive you a little bit that way as you rotate left, versus what a lot of people do is squeeze the glutes, and that is anti-rotation. It stops, so your spine has to twist in those directions, and the spine can twist, no problem. This is a long elevator ride. The spine can twist, no problem.
This is good. I need this.
We're in the Empire State Building. We're going up.
We're on a gondola.
Yeah. Anyways, the ability of the hip joints to become the primary movers, Happy Gilmore, man, it's all in the hips, baby. That's the truth of it. If your hips can become primary movers muscularly, not passively, but muscularly, you're going to experience a lot less pain, a lot more quality of life, a lot more powerful movement, a lot more spring in your movement into a much older age. And it's the kind of thing that all trainers and coaches and doctors that are musculoskeletal want their patients to experience and regain. And it's not just a hormonal thing. It's not just a dietary thing. It's those things. But it's also a very specific sequence of movements that the body has to train, and a very specific sequence of sensations that cater stability in those movements.
I love it. That's, I would say a couple of the key points that you said that and so, help me if I'm going to tell you some of the highlights I tell my patients. Sure. One of them is a little bit of a summary of what you were saying about the hips, and that one of the things I love about what I feel when I do FT myself and what I've seen happen through our patients working specifically with Jess, because really Jess is the expert in our company right now. So I have most of them training FT with her, the ones that I know really everyone can use it, we know that, but the ones that I know really, really need it. And what I explain to them is that a lot of times breakdown happens because of compensation, because we don't have that foundational stability, right? We don't have that as you described. I liked how you described that. It's hard to have a word for this, right? This like intrinsic and extrinsic stability that's a balance of each other. But that when we can refine that then our hips allow us to move, everything allows us to move. So that's one of the things I say. The other thing that I think you're touching on that I don't think it's not a very commonly talked about thing in concept in either of our professions, but that the entire purpose of the musculoskeletal system is to protect our organs. The skull protects our brain, the spine protects our spinal cord, the pelvis protects our reproductive organs. And what I explain to patients is we don't have a bony structure to protect the abdominal contents, really. And so what I feel from FT is that a lot of the intra-abdominal pressure that we need for true abdominal stability is regained through these patterns that you encourage in all of your movements and poses.
It certainly can be. It's certain because what we do. So yes and no. And I want to be so upfront and clear with exactly.
Oh, that's why I'm asking. Bring it.
The system that we teach, our instructors teach, that Jess teaches, that you're interested in, it could never stand alone.
Yeah.
Because it's scaffolding. What foundation training delivers is a broad, expansive scaffolding that the musculoskeletal system will adapt to and strengthen. And the result of that scaffolding is improved posture and more space for the abdominal muscles to contract accurately. But if you really want to teach breathing into the abdomen, that's very, very good, very strong, look at DNS.
Yes!
Look at powerlifting and Olympic weightlifting, and go listen to Pavel Satsaline talk about breathing. What we do in foundation training is we make sure that when your body learns that, it's learning it in the right places with the right space. And most people can't go from where they are into those breathing exercises unless, or at least not without pain and without kind of really having to learn it deeply, unless you learn to create room. Yeah. And you have levers in your body that create room, the SCM muscles, the lat muscles, the serratus muscles, the adductor muscles, the shin muscles. Those levers pull the body in such a fashion that it leverages space and, more important, density, a front to back space and width at the torso. Without that pull apart, which DNS teaches very well, which powerlifting requires, which the McGill 3, 4, whatever that guy says now, whatever those are, they're phenomenal exercises, but only done in a body that can maintain space. Yeah. And that's where foundation training weasels its way into all of these different systems, is we create the space better than anybody.
It's awesome. It's so funny because that's the exact manner in which I found you guys, is that I was using DNS with my patients and they were looking at me like, what, you want me to get in a baby posture? They were like appalled. Yeah, exactly. And some of them bought into it and some of them didn't. Then I found GMB, and GMB allowed me to have sort of pseudo baby postures without patients feeling like they were weird. They were okay with animal locomotion weird. And then Ryan introduced me to you guys. So it's really cool to hear that full circle. Now you're sending us back to DNS, which is right.
The body needs all these systems, and there's a reason that all of them are created. I will say, and yes, I'm biased, but I'm also pretty damn experienced, and this statement is made a lot more by other people than it is by me. So I'm at this stage more echoing than stating. But our work tends to serve as a bit of a missing link among these systems.
Yeah.
Without that posterior chain integration and the capacity of the serratus and lat muscles to intertwine, as we teach in decompression breathing, your body just doesn't have the room that it had when it was younger and more athletic. And my patient population, the foundation training population, spans all ages to a degree, but really the people that the work is for are in that older category. They're 40s and up. And they're people that are willing to do the work and are active and they're already, or at least pretty serious about doing things for themselves, but there's something missing.
Yeah.
And we're very often that missing link for people that want to keep doing what they like to do, but need the extra strength, the extra posture, the extra hip range of motion, the extra lung volume. That's what we tend to offer.
It's perfect. I love it. Thank you so much. That clears up a lot of things for me on the clinical side of things. I would love to hear a little bit more on actually building. So a lot of this podcast is helping other clinicians grow their practices. And so I'm curious, you and I were talking before we started recording how, this has been a 15-year process for you. And I'd love to hear a little bit of the business side of what challenges you had when in the earlier stages when you decided to, bring this to the public. And
sure. My process was I started teaching public classes off of the advice of some really interesting people that I interacted with. And this was back in 2009. I was living in Santa Barbara. I hadn't written a book yet. I was still naming the system, still putting it together, still trying to figure out. But I had like 8 or 9 poses that I had on repeat. I had them down. They were there. They were strong. So I started holding back pain classes. That's literally what I called them. Back pain classes. Then maybe 2 or 3 months into it, they started being called foundation roots classes. It's because we were playing with names. We were playing with all of that. When I say we, it was me and my closest friend since we were 14, Dr. Dustin Duricki.
Ah, cool.
Went to chiropractic school with me. We graduated. Neither of us ever practiced chiropractic. We just went right in. By the time I graduated, I was already pretty full on with what I was doing. Dustin graduated like 6 months after me, and at that point I had been testing it for 6 months, pretty much.
Awesome.
And we just went full on. We were like, well, I don't know what we're going to do, but we're going to do something. And we started.
But the world needs this, right? You're like, this is.
Yeah. So Dustin's the most important person in this whole picture. I came up with the idea and continue to do that at a very painstaking process. And Dustin's now helped me a lot. And Jesse, who's the main coach that people will see, has helped me for many, many years, especially bringing a more strength-focused, lat-focused, power pose type situation to this.
Yeah.
And I had other people. Brian King helped me over the years. Peter Park helped me write the first book and really he gave me a Rolodex that helped incredibly. He believes in the work. He still uses it heavily to this day with all of his clientele. He's a co-author of the first book with me, and he introduced me to everybody that got us to the ability to write that book.
So cool.
So there was a lot of connection, a lot of serendipity in the sense of people coming into the picture that could help me get the word out once they successfully improved themselves with it. That's the root of every story that has helped me in business. Yeah. Nobody came here because they liked me.
Yeah.
Everybody came here and they were like, I'm in a lot of pain, X, Y, or Z. And I said, are you willing to try something? And they tried it. And for whatever reason, it really worked in their body in a way like it worked in mine. And they've helped me grow it in their way since that point. So now you asked about business. We didn't know anything about business, and we lost a lot of money for the first several years. This was not a successful business. This was not a successful business for the first several years, not at all. And in learning a lot of lessons and kind of screwing up on taxes and having to pay a bunch of fees and paying people wrong and then having to pay them right and just making mistakes, I learned how to run a business with some people.
Yeah.
And we've all sort of gotten a degree in business accidentally over the past decade now. And we're decent at it. We've brought foundation training to a pretty powerful place now with a very small team. My business team, the people that run foundation training is me, Dr. Dustin Duricki, Jesse Salas, and Paul Matthew. and we have a wonderful customer service person.
I love it. You call them the cooks in the kitchen on your website, right? I love that.
And the recipe is pretty screwed up, but it's really fun. It's a good kid.
It's a family recipe.
Yeah, it's family. It's family secret,
That's cool.
No,
That's awesome.
It's an ongoing learning curve in business.
Yeah.
We have a lot. We have 1,400. No, I'm sorry. I'll say 1,300, so it's at least pretty accurate. We have approximately 1,300 foundation training instructors around the world.
Wow, I did not know that.
Yeah, we're doing okay in that regard, and
that's so cool.
And that's including basically a year and a half, 2 years off during COVID. But we've been certifying instructors since 2012.
That is awesome. I mean, I will say, I know you and I forget when we first connected. We connected for a patient that I had.
Probably
that was
2 years. I think 2 years.
Yeah, or more. I don't know, but I ever since then, I've definitely been following, and I'm so happy to hear. I think it was more.
I connected with Ryan like 5-6 years ago.
I want to say it was like 3-4 years ago, maybe, but I remember thinking like PTs, we clinicians need this. So I'm glad. I wonder, do you happen to know the breakdown of how many like clinicians versus trainers?
Oh, sure. I'll give you an approximate breakdown.
Yeah. I won't hold you to it.
Yeah, I would let me do it in two categories. The clinicians, the vast majority of clinicians that have come through our course are physical therapists, chiropractors. And then I'll sprinkle in a handful of osteopaths and medical doctors, and I'll sprinkle in a handful of occupational therapists.
Cool.
Now that probably makes up 65%
awesome
of our entire clinical or our entire instructor base. The others are Pilates instructors, athletes, yoga instructors, individuals who came through just for a better knowledge for their own pain management. 10% of maybe 20% of every course, 10 to 20% of every course is people that are just there for themselves. They're retirees.
Awesome.
They just want to understand it. They always bring a pretty fun energy because most people are clinical, and then there's just these other people like, what?
They're just totally different focus, right? They're just in the poses. The other people are like taking notes, studying the muscles. Yeah.
I'll have talked about something for 30 minutes, and I'll get a hand up, and they're like, "Could you point to the serratus anterior?" I'm like, "Oh shit." None of that made sense to you at all. Okay.
Oh, that's so funny. I love it. That's good though. Well, I'm happy to hear. I didn't expect you to say 65%. That's awesome. Because I think, like you said, missing link was a perfect way of saying it, because I will say I've had patients with chronic pain that we got like 85% without it. And then FTs just really brought them over the top. So
we've got a lot of success stories, and the people that have built this business are our instructors at this stage. Our instructors have expanded our reach in ways we never could have, ever.
It's cool.
Ever. There's a lot of Australians that do. There's a lot of New Zealanders. There's a lot of people in China. It's pretty wild. Like
that's really cool.
That's been the neatest. That's been the neatest process of just learning how to kind of not run a community, but how to be a part of a community by basically my job is to give to the community in such a way that they want to keep giving to our community and keep spreading it. So when I give them something new, it's got to be legit. I can't give them BS. I can't give them something that doesn't work. They have to be able to go test it with their patient base or their client base or their selves.
Yeah.
And that's been the growth opportunity and cost of foundation training. Not everything makes it. I've probably pulled 5 or 6 or 7 or 8, probably 7 or 8 poses off the list. Just they're not there anymore because one of two things happened. A couple people got hurt doing them. I've definitely done that before. I hate that some of the work has done that, but that's just the reality of having a body.
Yeah, you don't know until you try.
So crossovers, cross unders, lunge stretch. A few of my early, they're just not there anymore. We don't teach them. Brought in some newer things, understood it a little bit better, and then there's a couple. I'm trying to remember. I think this is why I stopped teaching the cross under. Is I was watching a Feldenkrais video from like 30 years ago,
and somebody
they didn't go into a cross under, or a crossover, but they went damn close. I was like, oh, that's, A, the body only moves in certain ways.
Yeah.
B, I can't claim that. That's not.
Oh,
that's not
wow.
That's not. So we just took it off, and it's
See,
just,
I think that's really respectable of you.
No.
I
We have
feel
one
like
goal. our work is original, and like our work is original and I have to be able to like, the one thing people will ever come at me with is, oh, I've seen this. This is, there's nothing new. There's nothing new. I'm like, you show me where you've seen my work before,
No,
and I'll take
never.
it. I'll take
No,
it down.
I agree.
Right. Yeah.
I think that's awesome. But I think it's interesting because I could have easily justified that for you, because the body, like, you can't own the body. If the body wants to move a certain way,
Of course.
how could people fault you for honoring the body's movement systems? But I know I'm not everyone, so.
And what we're trying to do, I want people going through my app, my books, things like that, and just being like, okay, interesting, and then they try it, and it's just like, whoa.
Yeah.
And if I have other people's work on there, it's not foundation training. It's foundation and then some other stuff.
Yeah.
Which we have a strength program that Jesse is creating. We have one version of it, but we're doing a bigger updated one for the app. And that strength program is foundation training a little bit into power lifts, kettlebell work, very important, almost diagnostic level strength work. And his capacity is huge. Before he ever got into foundation training a decade ago, he was really into the CrossFit world, the powerlifting world. He has certifications from Starting Strength, from Strong First, he's gone to them all. And he was able to bring that to FT.
It's awesome.
But that has to stand. That is a strength program based in foundation training. Whereas anything we're teaching clinically that kind of has that namesake has to be based on two principles completely, which is anchoring and decompression. And you have to, at any moment of the exercise, be able to see and feel those principles at play. And that's what makes our work very unique.
It's awesome. And the simplicity of it. I mean, it's simplistic complex. It's like so simplistic, it's complex.
That's a good description.
That's awesome.
It's like the whole puzzle looks so hard. You're looking at it, and it's like, what? And then you see the puzzle. You see that last piece that comes in, and you can no longer see the puzzle pieces. You just see the image. And it's the best thing you've ever seen. And the rest of your whole life, you only see that image. You're never looking for the puzzle pieces anymore.
Yeah. It's funny because I see that we have a pretty open floor plan here in my office. And it's funny because I've seen that look in patients who haven't been exposed to FT yet, when they see Jess working with other patients doing FT, and they look at them like, what are they actually doing? Are they doing anything? Like, I feel like they give this look of passing over it, like it's, you know,
standing there like this.
Yeah, like, well, boy, that's easy. I should do that, right? And then when they actually do it, they're like sweating. Yeah.
Oh, something's happening.
Yes, it's so funny. So anyway, thank you so much. This has been awesome. I think for final last question, I just want to leave our listeners with, if there's any words of advice as business owners or as clinicians, if there's, one pearl you could have told yourself 15 years ago when you were starting this journey, is there anything that comes to mind? Any advice?
Just don't get stuck in a protocol. Or if you are in a protocol, look for really interesting ways to adapt it and move it forward. Whether that's a way that you treat individual patients, or the way you treat a symptom, or the way you view how that symptom occurs, which is a really nice one. One thing I love to tell practitioners, especially chronic pain practitioners, especially people that are very often treating things like tennis elbow or sciatica or plantar fasciitis, just remember that a nerve is nothing more than a cord with two ends, and that tension can be held, and the culprit of that tension can be anywhere along that pathway, but it's very likely going to be felt at the most common places people feel that nerve, like the piriformis area, like the hip, like the plantar fascia. Even though the tension can occur anywhere on the chain, it's going to be felt at the proximal or distal end most of the time.
That's really good advice.
Situations.
Thank you. I'm with you on that. I feel like that's great. That's great advice. Thank you so much.
I mean, my first place to go for sciatica is like the lateral band of the foot and the shin muscle and the peroneus. Just like loosen up the tibia, that whole area, and all of a sudden there's a little more rotation and there's just more room for those upper leg muscles and the nerves around it. And that can happen anywhere in the body really easily, really easily.
That's awesome. Yeah, I noticed for myself clinically when I stopped like focusing on where they're feeling it and looking more at movement and where I see the breakdown happening, that opened up a whole world of success. And that's what you said earlier was like, you said FT has to work. Like the only reason anyone helped you build the company is because it worked for them. And that was something that resonated with me, and my hope for listeners too is that like just get people better. Like right? Like just get the result. Figure out how to get the results. FT is a great add FT to your practice, add other things to your practice. I also love that you said it's not a standalone thing. Like you're not saying it's the only way. You're saying this is an important piece of the puzzle.
One of my lines is, and I've said this so many times to a lot of different people, and eventually maybe somebody will listen in the movement world. Our competitor in the movement world, regardless of what we teach, strength, pain relief, whatever, our competitor is in no way, shape, or form each other. Our competitor is surgery, injections, Advil, Tylenol.
And
That's our competitor is people that are looking at the body differently than we are. If we try to make every movement we do better than every movement some other very intelligent person taught that person, we're both screwed up. Where the person's confused. No, dude, we're on the same page. We're all on the same team. I love that foundation training works for a lot of people. I hope my business grows forever and my family can become wealthy and beyond our wildest dreams because of it. But if that doesn't happen, I love teaching foundation training, and I want more people to understand that like we are one thing in a giant sea of people trying to come up with their best advice for your pain and your health. And just pay attention. Just pay attention. There's a lot of people doing it.
Awesome stuff. You are as authentic as I pictured, and I loved having all this time with you. I'm sure our listeners did too. Thank you so much. And I'm looking forward to Go ahead. I'm sorry.
No, I was just saying thank you. I appreciate the support. Thanks for inviting me on your podcast, and not just paying attention to somebody with some new thing in your clinic, but being like, oh, that's actually really interesting what they're doing. I appreciate that.
Oh, listen. Oh, you don't know the story of Jess? I told her she could work here if she trained in FT.
Oh.
She came looking for a job, and I was like, well, I love your energy. Yeah. I was like, I wasn't really planning on hiring, but you've got great energy. She was a brand new PT, which we know is, a little bit, I wasn't planning on definitely hiring a brand new PT, but she's passionate and she's energetic. And I was like, look, you're a find, and I really have been wanting to train in FT, and I just don't have the time right now. So if you train in FT, I'll hire you. And then she got into it, and she was like, oh, this is amazing. Thank you for introducing me to this. But
that's the coolest thing I've heard in a while. I love that. We're going to clip that. Give me that clip.
You got it. It's yours. That's my part of my thank you for introducing us to this world and for coming on the podcast. And for listeners, FYI, we are going to, Dr. Goodman and his staff, at some point we're going to host Foundations training here at Primal. So keep your eyes peeled on both Foundations trainings, Instagram, social media, everything that you can, and on our Instagram, social media, and subscribe to our podcast because I'm sure we'll be announcing it there too.
Yeah, awesome.
All right. Talk soon. Thank you so much.
Thank you.
Bye.